numerous symptoms from severe leg pain, left leg pain, pain in my ankle, just really a lot of difficulty moving around. And I had had lower back problems in the past, so I kind of knew what was coming down the pipeline. Well, this particular episode came on gradually over time. I remember I was in the lake practicing some kayaking skills when I felt some burning sensation in my lower back, and I'm pretty sure that's when it happened. And then it wasn't but maybe 2 or 3 days after that I was pretty much immobilized. It was actually a blessing in disguise that I didn't have to go into an office because I couldn't drive. But as far as the pain that I was experiencing, it was debilitating. I mean, it was hard to do everything. I had my second back surgery from Dr. Primrose. And I believe he was in practice with another surgeon during the first time I had back surgery back 20 plus years ago.
Wow.
So I found out he was working here and I wanted to see him, and so it was just a good fit. I walked in and I saw Dr. Primrose, and even before I got into his office for an examination, everybody I ran into was obviously, they could see I was in a lot of pain. And they knew that I wasn't going to be able to stand around and wait for a long period of time, and they expedited everything. And I was in and out very quickly. And we came to a diagnosis together, which is another thing I really appreciated. He didn't jump to the conclusion that I needed surgery right away. He said that that was an option, but he always asked me what I thought. Yeah, and then the other thing that impressed me is after my examination, I was ready to just collapse, because I couldn't really sit down, and walking was just very difficult. And when I got my shoes on and everything, and I was walking out of his exam room, he had prescriptions ready for me in hand. I didn't have to wait. Went downstairs, filled them within 5 to 10 minutes, and was home. So I didn't have any doubt in my mind that I was going to leave Virginia Mason feeling really good, and that's exactly what happened. I'm an avid sea kayaker, and I have been for approximately 7 years, and sea kayaking can take its toll on the lower back, and that's a passion that I'm not willing to give up. I had surgery on July 23rd, so about 2 months.
And how are you feeling?
Great. I mean, I couldn't sit here 2 months ago. I couldn't even begin to sit down 2 months ago. Never mind drive a car or even walk up a sidewalk. So I was pain-free when I woke up in recovery.
That quickly?
That quickly. Team medicine makes a lot of sense to me now, because really they have an entire staff of resources to go to and to bounce ideas off of. And I feel like my case was shared among many, not just Dr. Primrose, but I mean when the anesthesiologist came into the pre-op room, he came with his team. And I mean, they were all smiles, and they said everything's going to be great, and they talked to me about what I was going to be going through, and just completely set my mind at ease. So there's no reason for me to go anywhere else. I can't imagine being treated better anywhere else. I would definitely come back to Virginia Mason as opposed to choosing Overlake or the new Swedish facility that's being built 5 minutes away from where I live in Issaquah.